Regulation. So as we continue spending more than 35%, it means we are spending lower than 30% on development as expected from the same regulation. It also means that in terms of service delivery, we're not achieving where we should be because we are spending much more. So basically it's crowding out financing for development and for service delivery. We have seen that quite a number, most of the counties are actually above that target of 35%, with the exception of about 6. Another 10 are close to that figure, they are under 40. But we also have county governments that are spending as high as nearly 60% of their revenue on the wage bill. So as we spend more and more on wage bill, definitely development will suffer. Service delivery is also going to be impacted. But I also want to say that some of this is not necessarily a bad cost. You know, you have good costs and bad costs. When you look at the revenue at the county level, it has also gone into service delivery. Specifically, health is devolved.
Yes.
And for Kenya to achieve the right ratio of healthcare sector to the population, then we've got to continue employing the healthcare workers. We are not even at the stipulated WHO ratio. We're still below that. So as our population grows and we've got to reach everybody in terms of service delivery, then we will of necessity continue to employ more healthcare workers. The other service that is devolved and will continue also demanding more personnel is the ECD. And the ECD, which is also devolved, there's been a lot of recruitment also to fill that gap. So as we look at this issue of wage bill, we've got to look at it from two perspectives. One is that as you continue to reach the population, then you will increase the wage bill in absolute amounts. But the concern then is the ratio, rather than the absolute amount, which will continue to grow as you deliver services to reach the population. So that is what our problem is. It is the ratio. And therefore, as we begin this discussion, the question is always, is the problem revenue or is the problem the wage bill? Which comes before which one?
Let me hold you there, Madam Lynn Mengich, and really move to the governor here, who is the man on the ground, the county level. Governor, some of the members of the COG have expressed to me, at least, that as Lynn Mengich rightly put, that maybe the challenge we have is what we have been prescribed as the sources of on-source revenue. It's not really the wage bill problem. What are your thoughts, Governor?
Thank you very much. I think I want to begin by saying we are focusing on the wrong thing. Service delivery, working back historically, was given by one source called the national government. Suddenly, after the promulgation of the new constitution, we had 48 units. I'll give an example. A few years ago, we had only 8 provincial hospitals. Today, they were level 5s. Today we are talking about 47 or more level 5 hospitals. These level 5 hospitals have continued to increase, and the labor that we have there, the doctors, when you talk about specialists, in other words, we are saying Kenyans are continuing to pay for the services they are getting. We have also forgotten that when we were coming up with all these ratios, the PMF and what have we were still not, we were really focused on the bigger picture, which is the national government. But today we are speaking about 48 governments that are providing services. So as much as we all agree that we want development, we must also, on the other hand, think about the services we are giving. I hear that there are 6 counties that are not, that seem to be behaving according to the PMF Act. I'll tell you some facts. Some of them have not even hired ECD teachers, not because they don't want to, but they can't afford. I will mention Elgeyo Marakwet for one. They are struggling. They have a total revenue of 3 billion. And the governor will tell you that he might, if he can spare 200 million on development, it will be a task. So really, what is the big challenge we have here is, I think we need to relook at those ratios. But at the same time, let's also understand that when we talk about own revenue, own source revenue, and the revenue that we are supposed to increase, number one, we must ask the National Treasury to be a neutral arbiter. Unfortunately, it's skewed towards national government. When we pay our taxes, and we are supposed to get, let's put it at maybe 35% or whatever percent we get, rarely does the national government and national treasury release the money in time. This one affects service delivery. It also affects collection of own source revenue, especially where you have demotivated staff who have not been paid for 4 months. And that one has a bearing on the end result of how much money will a county have collected vis-a-vis how much it will have spent. So these are areas that need to be looked into. And finally, let me say this. Some of the functions, and Len Mangich has just mentioned, like the ECD function, it was devolved with 0 funds because Kenya has never been serious about ECD. And it's a fact that this government, and not necessarily this, but all governments in Kenya have never taken ECD seriously. And the only thing we can see about ECD now is what has been done by county governments, yet they had to go back to their revenue to do the infrastructure, hire teachers, provide learning materials. When we talk about vocational trainings, VTCs, they were devolved. Initially, there was a 2 billion conditional grant was given, which was withdrawn the other year and merged into, as Kenya was struggling to look for 53 billion to add to what we were already getting. So we realized that those 2 functions, which have been handed over to us, and devolved, were not devolved with the requisite funds. Finally, we have fully devolved functions like health, water, and agriculture. But look at the national budget. Health has 47 billion. Just to do what? Policy. When we look at our hospitals, our doctors, right now as we speak, out of the counties, 1,000 doctors are in universities in Kenya. We are paying their salaries. They are not serving the counties where they come from. The Constitution abrogates that responsibility of training to the national government, but the national government is merely paying for just for their training, but we have to bear the burden. And this is clearly, these are some of the reasons.
Governor, let me hold you there. I'll be coming to you with a raft of questions based on the things you've said. But let me come to Dr. Abraham Rugo. And the governor seems to intimate that perhaps we should relook at the prescription in the PFM Act around 35% ceiling. Your thoughts on that?
Thank you. In fact, I think it's important for us to appreciate that 35% was not necessarily a developmental parameter. it was not a scientific figure that is informed by the level of development, because all counties were not starting at the same level.
True.
And therefore, when you say every county has to spend at the same level, take an example. Right at the point of devolution, Nairobi was starting at above 35% because of just the level of city council officers who are there and just the magnitude. Turkana was starting at below 5%. Today, Turkana is at 36% in terms of its spending. But you still cannot compare Turkana County and Nairobi County. And perhaps,
from a low base.
And what happens, what you notice is that all counties that had and now have huge urban areas are the ones that are spending far much more, because their population is big, they had municipalities that they had to absorb. Secondly, at the point of devolution, there was also an inequality that happened, not only in terms of the number of staff that were being absorbed, but also there were a number of collective bargaining agreements that were made, and counties had to absorb them. You've seen strikes of counties being punished for refusing. So when you think about the 35%, from where I sit, we think it's something that must be prorated depending on the level of development, because it means very different things. But a more related matter is, what do we consider development? In the PFM Act, we cluster development largely as brick and mortar, as capital projects. But development is not just brick and mortar. Development in healthcare is actually having doctors and nurses and clinical officers and essential medicines, the supplies, within those health facilities. And therefore, a county like Kitui does not have to build more dispensaries. If anything, they have an excess of dispensaries. The last report by CRA, I think they had an excess of about 104 facilities, physical facilities. And therefore, they need to spend more on putting nurses in those facilities, and that is a recurrent expense, and that's a wage expense. So I think in the conversations moving forward, and I'm glad that at this third cycle, perhaps it's time to go back to some of those ratios, and I like what Madam Mengichi was saying, that we need to go back to those ratios and ask, are they serving us? Because for some counties, achieving 35%, being below 35%, actually means not providing services. For others, it becomes aspirational, because then it is the ceiling to hit, and yet you still don't have the staff. So you either are paying staff so much, you have all these allowances floating all over the place, because you are still saying we are still below 35%. All is well. I think for me that's my take on the
Doc, let me hold you there, and just for the sake of obvious, when the doctor talks about the third cycle, it means the third revenue allocation cycle, which is developed based on the formula crafted by the Commission on Revenue Allocation. Let me come to Irene here. And Irene, it looks like one of the issues emerging here is that we have a resource envelope challenge, much as we want to focus on the wage bill. Is this a view that you share?
Listening to my panelists, I think it's a bit premature for us to start saying, let us review the percentage, if the percentage is working for us or not working for us. The reason I say this is particularly for Kenyans who are paying tax, that is the only measure we've been having somewhat to hold government to account. So in the absence of that, I don't see how citizens would hold government to account. My first concern when we are talking about saying what Governor, His Excellency, is mentioning, my first concern is when you look at questions that have been raised by the Control of Budget and other agencies. First, we have an issue of the revenue being used at source, some. So even before we say the revenue is not sufficient, I think that before we have that conversation, we have to ensure first the accountability issues around revenue, whether we have that percentage or not, is addressed. Because for at my immediate thinking is that there's quite a bit of accountability issues and wastage, so that the numbers we're even talking about as the revenue potential in some counties may not even be factual because of the reports we are seeing from oversight institutions. The second issue again is when we are saying what Dr. is saying in terms of some counties would want to invest more in, say, salaries, that is what for them would be development. I beg to differ a bit, or not differ per se, but say then deeper scrutiny to see within what we are saying is actual wages. We've seen a lot of allowances that are actually for work that someone is already being paid to do. So even if we say for the counties that for them they've reached an optimal threshold of development proper, which is brick and mortar, and we then want to say let them put more on, say, salaries and wages, the recurrent, we need to look at what constitutes that recurrent. Is it more of allowances, and are those allowances really eligible and rightful for them to get? Secondly, again, even as we say the wage bill is a bit high, we need to see or get more statistics from the Salaries and Remuneration Commission and say control of budget to see who draws a lot of this. Is it the assembly? Is it the ECD teachers that we are saying? Is it the health workers? Because from research that we've undertaken in select counties, what pay the ECD teachers get, and particularly even the vocational training, is really not per SRC rates. Very few counties have adhered to that. I would point out Vihiga, that is paying the vocational training team at SRC, but others are really paying them wages that are below, are not even living wages. So we need to look at it deeper before we start saying the percentage is not working or issues around that. In terms of resources, I think taxpayers are paying quite a bit at county level. So the question is, again, if they do not see service delivery, this again is going to be a demotivation. If we are saying you want people to pay tax, but they are not seeing salaries, and they are not seeing development, but rather people are paid. I'm not so sure the taxpayers at the subnational are ready to view service delivery as actually payment to civil servants. So we need also then, if you want to go that direction, reorient the population. Otherwise, their morale for tax paying is going to go lower than it is.
All right, and just again, for the sake of our viewers, when you talk about revenue being used at source, essentially, ideally, it would come to almost a consolidated fund before it is pushed for use. And that's one of the reasons why the IMF was recommending the shift from cash accounting to accrual accounting. Let me just come to Madam Lynn Mengich. 35%. The argument seems to be that it's an unjust ratio for a number of counties. What's your take on that?
My first take, and I want to agree with my panelist here, around accountability. If you remove a ratio and there is no target that we are working towards, then you remove accountability. As to whether it is the same for every county, that's a debate that we can look at. But it's very important we must have a target to work towards. She has pointed out issues about wastage, which we know is there. So even as we are saying it's something maybe is not possible to get to 35, but we also have counties that have demonstrated, let alone the ones that are below that he mentioned, but we have counties who are actually close to that 35 and they are delivering the services. So for me, where I sit is, there are counties that are demonstrating that it is doable. Now, the other thing I want to bring out is this issue about on-source revenue. Because the wage bill is got two elements. Obviously, one is increase your revenue, and then the other one is manage your cost, which includes eliminating wastage and accountability. I want to bring in the perspective of our level of productivity, all right? And if I can just share with you very quickly, even as a country, Kenya today, in terms of productivity, based on statistics released by ILO last year, Kenya ranks 151 out of 162 countries, right?
Yeah.
In Africa, we are number 15. Now, why is it a very important factor to consider is productivity in itself is an economic indicator that is linked to economic growth, competitiveness of the country, and living standards of the citizens. So as much as we are talking about all these ratios, if we are not productive, then our economic growth will suffer, our level of competitiveness will suffer, and living standards. So if I take that argument to county level, it is saying as a country, let's acknowledge we are not doing well.
Yeah.
And therefore, by extension, even the counties are not doing well on productivity. If as a nation we just simply focus on productivity, we will be able to increase our revenue. We will see more revenue, and therefore that ratio in itself will be addressed. So it's important that we look at it from both perspectives, with what do we need to do. So I just want to talk about, His Excellency said on-source revenue is probably not one of the key factors. But recent study by CRA, which was shared with the county governments just a month ago, CRA have demonstrated that there is a lot of potential in each county to actually improve their own source revenue drastically. And they went into details by county and what can each county do to increase their own source revenue. So indeed, counties have opportunities to increase revenue. National government has opportunities to increase national productivity. And as a country, we must have a national conversation around productivity. Otherwise, this issue of wage bill, and more specifically, the issue about are we delivering the services to the citizens, even at county level as required, we are not. Yeah. We have not reached that. I just mentioned about the ratio of healthcare workers to population. Based on WHO, we are below that. Ratio of student today to teachers, we are below. So if we are not getting to that level, then we cannot just look at only one factor. Even if we try to be as cost effective and we lose out on productivity, we may not achieve what we want to do. So for me, it's both. Yeah. Need to focus on productivity, but we must talk about accountability, wastage. And we do know for a fact, based on a lot of reports, that there is a lot of wastage of resources at the county and even at national government level, and lack of accountability. And that is something also we must continuously to focus on.
Maybe just a quick rebuttal before we take a break, Madam Lynn Mengich there. We have had a conversation with the SRC before around the push for a productivity index. Any status update on how far we are with this?
As a country, first, let me start by saying that we do have a national productivity center that has been in this country for many, many years. But if we were to look at where are we compared to other countries, we're not doing very well. The countries that I mentioned are doing very well on productivity. They've got productivity centers that are functional. And so as a country, do we have productivity measurements that we are using? The answer is no. Okay. Almost more than 15 years since this center has been in place, we don't have today productivity indices. Okay. But where we are at the moment is, as a result of the wage bill conference that was held in 2019, there were resolutions passed at the summit